Hello everyone. So let's start with the discussion of upper limb. So in upper limb, there are so many topics which is important and which will be covered along with the explanation, and the concepts will be cleared. Along with it, it will be also included or followed by MCQ discussion. So let me start with the first topic of upper limb series, the axilla. So if I talk about the axilla, it's a truncated space. In normal terms, we use the word armpit. Okay, so it's a truncated space which is exactly called as armpit, and it is having 6 boundaries. It is having a posterior wall, it is having a medial, lateral, anterior, and also you can see this is the apex which is extending into the neck region, and lower down the axillary fascia is forming the base. So let me individually explain you and show you the diagram so that you can understand the concept of the axillary walls. Okay, so let me start with the apex of the axilla. When I am using the word apex of the axilla, it is also called as cervico-axillary canal. Why it is called as cervico-axillary canal? Because axilla can communicate in the neck region via apex of axilla. It is important that you should understand the boundaries of the axilla. Boundaries of axilla. So for that, firstly I would like to explain the boundaries of the apex of axilla. Here it is bounded posteriorly by superior margin of the scapula. It is bounded medially by outer margin of the forestrip and anteriorly by middle 1/3 of the clavicle. Now, so this is the boundary of the apex of axilla. Now let's discuss the boundaries, the medial, lateral boundary, anterior and posterior. So let me enlarge this. I will write it for you, don't worry. So here what happens, if you will see this image, here one of the muscle which has been dissected out, as you can appreciate in this diagram, this is the cut part of pectoralis major muscle. So here you can see the pectoralis major muscle has been dissected out. So pectoralis major muscle has been dissected out. Now underneath you can see the pectoralis minor muscle. So this is the pectoralis minor muscle, and the small muscle which is lying below the clavicle is the subclavius muscle. So actually here pectoralis minor muscle overlapped by the pectoralis major muscle which has been dissected out, and the subclavius muscle. Pectoralis major muscle is lying superficially, and deep to it we have got the subclavius and the pectoralis minor muscle. Okay, so clearly these 3 muscles are forming the anterior wall of axilla. Now when I am talking about the posterior wall, so here you can see this is the subscapularis muscle, this is the teres major muscle, and this is the latissimus dorsi muscle. So these 3 muscles from superior to inferior, that is the subscapularis muscle, teres major muscle, and latissimus dorsi muscle. Okay, subscapularis muscle, TM for teres major, and lower down is latissimus dorsi. Now also you can appreciate in this diagram here, these serrated like muscle which you can see on the medial aspect is the serratus anterior muscle. So serratus anterior muscle is forming the medial wall of the axilla, and laterally it is having the boundary by the humerus bone, and the humerus bone is overlapped by, as you can appreciate in this diagram, it is overlapped by short head and the long head of the biceps brachii muscle along with coracobrachialis muscle. So here very nicely we can see here serratus anterior muscle. These serratus anterior muscles are forming the medial wall. This is forming the medial wall. The muscles which is lying over the humerus bone, which is attached to the humerus bone, and the humerus bone is lying laterally, the coracobrachialis and the biceps brachii is forming the lateral boundary. The anterior muscle which is lying on the chest, that is pectoralis major minor subscapularis, is forming the anterior wall, and posteriorly from top to bottom we have got 3 muscles, subscapularis, teres major, and latissimus dorsi. Now if I talk about the basal aspect of the axilla, it is merging with the axillary fascia. So we have already discussed and we have seen the boundary of the apex, and let's see the important boundaries. I will write it for you.